Today we're going to talk about a very interesting topic called constipation. And I've asked you, because you're a pediatric gastroenterologist, to be my subject matter expert here. Now we work together, you actually do some moonlighting with me in the pediatric emergency department. And so we have a lot of fun and a lot of exchange of expertise between the two specialties, and that's just been a delight. But you're trained in pediatric gastroenterology, and where did you train at?
So I did residency in general pediatrics with the University of Florida, and then I went to Yale where I did my fellowship in pediatric gastroenterology.
Okay, in the first year, you think it has something to do more with their diet?
Yes.
Okay.
And hydration. So if you look at the babies that are breastfed, I mean, you will never see constipation in those babies.
Yeah.
Unless there's an actual dysmotility disorder.
Okay.
If you look into the babies that are formula fed, you may see signs of constipation in a couple months of age, and a lot of times they start forming these Play-Doh consistency stools that are struggling to actually pass.
Okay.
And then once you introduce baby food in both of those groups, formula-fed babies as well as breastfed babies, some, depending on what you're introducing, it may cause some constipation in doses.
So let's bump ahead then to the kid in the 6-year-old, the kid in first grade, the 7-year-old, 6 and 7-year-old with constipation. Is that diet? Is that lack of fluids? Is that lack of activity? Or is it yes to all those?
It's yes to all of those. And one of the major things I've seen is when you combine bad diet with a very challenging environment in terms of now the kid goes to school, they're limited in terms of how they can use the restrooms, sometimes they're embarrassed using the restrooms. So they withhold. So in that group, once they somewhere between 2 years of age and up to 5-6 years of age, a lot of the problems with constipation comes from diet, or the child is actually withholding.
Okay.
And especially between the ages 2 to 4 or 5 years of age, that can be a major challenge.
Okay. Okay. Acute abdominal series, so forth. What's your thoughts on that?
I think if the patient comes in and they're clinically clear constipation, they have those symptoms and there's nothing else going on, and the physical examination is reassuring, I don't usually do the KUPs. I think the clinical history will be sufficient, assuming I don't have any other concerns. In some instances, you can have an autistic patient where the history is just not adequate, or you may have parents that have they're not even sure about the bowel movement patterns because the child goes to school and they may have developmental delays. So in some instances, it may help. What the difficulty is, even if this when they do clinical studies on this and they asked radiologists to review those X-rays, the reliability of it wasn't very good.
Yeah.
And because of that, if it is clinically clear constipation, I don't think that's doing KUB would be much better. It wouldn't add much to the quality of care you can provide.
Yeah. Yeah.
But I think if the history or the clinical examination is not clear, then a KUB may be helpful to look for, have an idea of the stool load, but also rule out other causes.
Yeah. Make sure it's not a bowel obstruction or something like that. I kind of approach belly pain a little bit, and I'm thinking it's constipation. They got belly pain. I don't just send them out with the diagnosis of constipation. I need that belly pain gone before I am comfortable. So that's why I'm fairly aggressive on treating them, because I want them to say my pain's gone, my belly pain's gone. Then I can go home and I can sleep comfortably.